This time we want to talk about legalizing cannabis, and we told you that there is a growing list of countries both in Africa and around the world where cannabis sativa has been legalized, but Nigeria is not on that list. And we see a growing list of drug law enforcement agency war against those who grow and sell the crop popularly called Indian hemp or weed in this part of the country. Now the battle, the NDLEA may not be close to winning as Nigeria is a major source of West African grown cannabis and ranked the world's eighth highest consumer of cannabis. And the question on the lips of many is, if Nigeria is going through this challenge, why talk about legalizing the use of cannabis? And we have joining us Dr. Samuel Adekola, National Chairman, Association of Community Pharmacists, here to talk us through this. Good morning. Thank you for joining us on TVC Breakfast.
Thank you.
Now, like we had pointed out, the issue of the use of cannabis sativa has been on the front burner in Nigeria. We see the war the NDLEA has been waging on a daily basis. And we even heard the chairman of the National Drug Law Enforcement Agency, in person of Buba Mawa, saying that legalizing the use of cannabis sativa will be mortgaging the lives of citizens for financial gains. And now we are here saying that we should look at that. And I am wondering why.
Thank you very much. I think the important thing is getting the perspective right.
Right.
I think that's what we should be talking about. It is not about saying it the way this. I mean, it's actually the way it is that we are saying it. Right?
Okay.
So we should say it the way this. For example, when the governor of Ondo State, that's where it all started,
yes,
came up to say, oh yeah, there's a need to look into legalizing, working on cannabis, saying the kind of, this started in 2018,
yes, when
he visited Thailand and visited Canada. See, that what he saw the countries benefiting from cannabis, and he felt that, oh, if we are just growing these type of things here, and we're not taking benefit, then we are probably deceiving ourselves.
All right.
In tandem, of course, he's not a medical doctor, neither is he a pharmacist, but he's a lawyer, a well-read person. But in tandem, the WHO was working with the UN, and this crystallized to the decision of 2nd December 2020, when the cannabis was formally and officially declassified. It was taken from the 1961 convention and moved now to, instead of being a drug that is seen as a bad drug, it's being classified as pharmaceutical product. So, which shows that it has some level of, it can now be used. It can now be, the way it was being seen before, it is now, and that's why you see countries in the world, even before that day, they've been legalizing it, and much is been done, and they're taking serious benefit from it because of the huge benefit that is intrinsically with the cannabis plant. However, we're getting something wrong. The call for legalization of cannabis is not talking about legalizing it for recreational use.
Okay.
There are 3 classifications. Even, I'm a pharmacist. The World Body of Pharmacists, International Pharmaceutical Federation, had taken decisions on cannabis long time ago. In fact, the last statement on it was issued in 2018 after the council looked at it and felt, okay, there are benefits, and therefore countries can go ahead and get cannabis legalized. However, in trying to legalize cannabis, every jurisdiction that want to do this must ensure that they carry the pharmacist and the body along, because they are the one that have the requisite knowledge. They are the one who has the jurisdiction in terms of drugs management, pharmaceutical drug management. So that is one hand. However, even there are countries that came to the International Pharmaceutical Federation to ask for legalizing it for
export?
No, not export. They were asking for recreational use.
Okay.
In a sense. This, the FIP refused to give approval. And incidentally, coincidentally, the same thing here. What the government of Ondo State was saying, and what even the people who are promoting it right now saying, and member of the National Assembly, as we speak, we have laws that are being reviewed.
Yes.
What they are saying is not legalizing cannabis for recreational use. It is still prohibited for recreational use. And what that means, smoking, that's recreational. But we're talking about cannabis legalization for medicinal and industrial use. Okay. Because there are so many disease conditions that can be treated, that can benefit, so many disease, a patient can benefit from cannabis extract. And therefore, the call, of course, if there's no basis for WHO decision to reclassify, which UN passed on 2nd of December 2020, then there will not be basis for anybody to talk about it. So it is entered then with that spirit, with that norm, that convention, that we're saying, okay, yes, let cannabis be legalized. In fact, what Ondo State people were asking for, the governor of Ondo State, because we're there at their round table, what they were asking for is even they're looking at control cultivation, state control cultivation, and such that this plant can be taken, in terms of the growing, control the cultivation, and of course from there, you move to the second level for extraction, you go to another level of industrial. So this is what he's talking. So Buba Marua, as a friend, I must say a very good friend of ours, in a sense, the information is that he got it wrong by saying we're not asking for legalization of cannabis for recreational use. Let that be clear. It is for medicinal and for industrial purposes. Now,
the challenge then, I wonder if you see it as a challenge too, because you have talked about states, in taking charge of or limiting its cultivation, which a lot of persons are also wondering, will we be able to regulate such that we wouldn't see sharp practices where persons are involved still in recreational use and we still get the rising cases that we are seeing now, if we say the essence is to just narrow it down for medicinal use?
Now, the point is that the question is, even now that is prohibitive, that is entirely not legalized, what is the situation with it? What is the level of the abuse? You get a point? What is the level of abuse? What we are doing right now is that we are making it available for those who are desperate.
Do we have the structure in place?
The structure to regulate growth and manufacturing, we have it. We have NAFDAC. Even NDLEA too is part of this. Is part of the structure. So it is bringing everybody to the table. And I can tell you, even those who are growing right now, the truth about it is that if they see reason why they have to make it, grow it for more economic benefit, I'm telling you, they are going to leave the abuse which is currently being used for. That's the truth. So
perhaps you need to enlighten us on these benefits that you have been harping on all the while.
Well, I talk about medicinal benefit.
Right.
It's been used. It's been. What today is one of the anti-pain extract of cannabis used in terms of, even glaucoma, in management of pains, even with cancer patients. It has several uses, even for treatment of even craziness we're talking about, the malady we're talking about.
Really?
Yes, it's been shown that it can be used to, Bible you say, we're laughing with. So what that means that it's been found that cannabis itself can also be used to address even the issue of insanity, so to say. But let me say that I'm happy for this opportunity, but as pharmacists and as a group of pharmacists, we are taking this discussion further, and that is leading to what I also I would like to say here, that by God's grace, come the first day of September 2021 in the city of Abeokuta, we are going to be having a roundtable discussion plenary section by community pharmacists.
Our key stakeholders going to be there, especially in the person of Abuba Mawa, who is saying...
We will be willing to get him there.
Right.
With extend invitation. We'll be happy. We bring in people who believe. We bring people who do not believe. We want to talk as professionals. We want to look at demystifying the cannabis. We want to see the meat and the fact in the eyes of science. Is it actually? So let's debunk if it's actually, and if it is, let's prove it. Let's put it on the table. Not just talking, but this time as scientists. And that is why I want to invite you and invite every Nigeria to that roundtable. It is open between 9 and 12, 9 a.m. and 12 noon on 1st of December, 1st of September at Abeokuta Conference Hotel, Moson in Abeokuta. Everybody is welcome to come and express, come and listen. Let us talk it together, because we have seen reason why Nigeria should benefit from this. Our people are suffering, and as we speak today, there's no basis for destroying what would have been used, what would have benefited us, medically, and what would have also benefited us by way of economically. So there was basis of destroying them.
But so do you think now that if we legalize, a drug-free nation is possible?
It is possible. It is possible if cannabis is legalized. It's unfortunate that we want to, why don't we go to states and countries where this has been legalized and see what is the impact? How crazy are the people there? How many crazy people have we found on the street of such places? And that's the point to mention specifically.
All right, so your final word on this now, as we try to demystify the whole essence of legalizing cannabis. Your final word.
Well, my final word is that cannabis has benefit. It used to be a bad drug. A crazy. At the time,
there were no research done.
Yes, evil plant. But now, like I described it, for me, I describe cannabis now as the Paul of the Bible, who was used to be Saul. But now, when discovered, Jesus turned Saul to Paul. God, let me use the opportunity that I seriously ask the people to come to Abeokuta for this discussion. And among other things in that discussion, we also have, I'm happy the doctor that just left spoke about primary care issue. And that's another issue we're looking at, because the national conference of the association that's taking place from the 30th of August to 3rd of September. On the 30th of August, we're going to be having training and certifications of about 200 community pharmacists for vaccination in Nigeria to support, because that's one problem the doctor was trying to allude to. We have issue of serious manpower shortage. Yes. And Nigeria have not taken benefit of trying to get maximizing of the tap potentials that we have in the country. And this is one of the reasons why we're calling on Nigerians. We want to get our people to be protected at the primary care level. So I call on government, I call on the people, I call on TVC to be part of that wonderful outing. Thank you very much.
Thank you so much, Dr. Samuel Adekola, National Chairman, Association of Community Pharmacists, for your time on the program.
Thank you.